Hello everyone. In previous videos, we discussed about the definition of C factor, its clinical significance, and how to calculate the C factor for class 1, class 2, MOD, class 3, and class 4 tooth preparations for composite restorations. In continuation to those videos, let's calculate the C factor for class 5 tooth preparations. So let's start. Say if we look at the C factor of class 5 preparation, there are basically two conditions. See, the first condition of class 5 is that when it is ideal shape, that is box shaped cavity, as you can see in this image. If you look at the bonded surfaces for composite restoration in this, one will be the incisal surface, one will be the cervical surface, one will be the mesial and one distal, and this axial wall. This will be bonded to the composite restoration. So there will be 5 bonded surfaces. And if we look at the unbonded surfaces of composite restoration in case of box shaped class 5 cavity, the surface of restoration which is visible, which is forming the labial aspect of the tooth, that will be unbonded. So basically, we'll be having one unbonded surface. Since the C factor is ratio of bonded to unbonded surfaces, what will be the C factor in case of box shaped class 5 cavity? It will be 5, which is equal to class 1 cavity preparation for composite restoration. So this is the condition when we make the class 5 cavity as box shape. But what about the C factor in case of non-carious cervical lesions, which are also forming the class 5 lesions? For example, abrasion, erosion, abfraction. So what will be the C factor in these cases? If you look in this case, only this prepared tooth surface that will be bonded to the composite, and otherwise there are no specific line angles, point angles or walls of the cavity. So all these surfaces, for example, the cervical, mesial, distal, this coronal surface, and the part of restoration which is forming this labial surface, they will be unbonded. So in this case, the ratio of bonded to unbonded will be 1 by 5, which comes out to be zero point 0.2. So I hope this difference in C factor in two different types of class 5 cavity preparations is clear to you. One is box shape where C factor is 5 because there are 5 bonded surfaces and one unbonded surface. And in case of non-carious lesions or where there is no specified class 5 cavity, then we have the only prepared tooth surface which is bonded to the composite restoration, and we have the 5 surfaces which are unbonded. These 5 surfaces are which are present on the root side, coronal side, mesial, distal, and one forming the labial surface. So in this case, the C factor comes out to be zero point 0.2. I hope it's clear to you. So I hope from these 3 videos, you have clearly understood how to calculate the C factor. Now I'm putting 2 questions for you: how to calculate the C factor for a composite veneer, and what is the C factor of a prepared root canal. Try to calculate the C factor for these 2 conditions and answer me in the comment box. Thanks for watching. Stay connected for more such videos. Goodbye and take care.